Starting with the cases of Aicardi syndrome. Aicardi syndrome imaging descriptions. So the left is a sagittal T2 weighted fat suppressed MR scan in a 4-year-old female with a known history of Aicardi syndrome and coloboma with chorioretinal lacunae, and it shows near complete agenesis of the corpus callosum with an azygous ECA. A retrocerebellar cyst with elevation of the torcular is also noted. The vermis and tectum appear dysplastic. Right is the more lateral T2 fat-suppressed MRI sequence in the same patient, and it shows multiple nodules of heterotopic gray matter, which are seen protruding into the lateral ventricle. So on the left, that's the coronal sequence of the T2 fat-suppressed scan in the same patient, and it shows the characteristic Viking helmet sign of the corpus callosum dysgenesis. The prominent heavily myelinated props bundles are also noted. They are also present, as are multiple nodules of periventricular heterotopic gray matter. Right is the axial color DTI in the same patient, and it shows the prominent parallel and non-converging props bundles in green. So the left is a 38-year-old female patient with a history of breast cancer, which was presented to the ER with several months of increasingly severe headache and visual difficulties. So the non-enhanced CT scan shows a large hyperdense mass in the right occipital region. The right is the axial T1 contrast-enhanced MRI in the same patient, and it shows a large, intensely enhancing right occipital mass. Left is the sagittal T1 contrast-enhanced MRI, and it shows the well-demarcated, intensely enhancing mass, which is seen to be abutting the dura. Right is the axial pre-surgical contrast-enhanced SPGR, and it shows a subtle dural tail along the tentorium cerebelli. Preoperative diagnosis of meningioma was confirmed at surgery. Further evaluation disclosed the TP53 germline mutation, and Lee-Fraumeni syndrome was diagnosed. Left is the axial T2 weighted MRI of a 47-year-old man with schwannomatosis, and it is showing the bulky fusiform enlargement of the bilateral trigeminal nerves, which demonstrates the heterogeneous increased T2 signal and exerts mass effect on the pons without associated signal abnormality. On the right, that's the coronal sequence of the T1 contrast-enhanced MRI of the same patient, and it is revealing the enhancing globular masses involving the bilateral trigeminal ganglia, which are seen to be extending into the infrazygomatic masticator spaces via the widened foramen ovale. Internal auditory canals, they are not seen here, they are not shown here, but the internal auditory canals in this patient were normal. They were normal. Left is the axial contrast-enhanced CT scan of the neck in a 31-year-old woman with schwannomatosis, and it shows a circumscribed, encapsulated, heterogeneously enhancing submucosal mass in the supraglottic larynx, which nearly completely effaces the laryngeal airway. Coronal reconstruction reveals the additional heterogeneous density masses involving the left brachial plexus and jugular foramen, compatible with numerous schwannomas in this patient with schwannomatosis.